Welcome back, Caitlin. I know you like to tan.
Oh, in the summers I do.
Oh,
Feels so good.
I used to too. But Dr. Hoffman with SkinWin Dermatology has something to say about that. So I talked with him about skincare heading into spring and summer.
It's very important, but I would say it is important year-round. Spring, summer, yes, we think, oh, that's when we're spending more time outdoors and more sun exposure. And people really still do a lot of outdoor things in the winter. And in particular, if there's snow on the ground, you get the direct sunlight from the sky as well as reflection off the snow. In addition, when you're out driving, the windshield glass is not UV protective. And if you're out in your car for more than 20, 25 minutes, that should be considered outdoor time, and you should be protecting yourself. And that's really a year-round recommendation.
We were just talking today about wanting to get that nice tan, that nice glow as you head into summer. I know you're like immediately like, no. So
No.
How much do you have that conversation with people who say, well, I've only been tanning for 20 years or something?
Dozens of times a day, every day would be the correct answer to that. So some people have gotten the memo, but I'd say a lot of people not. There really is no such thing as a healthy tan or a healthy base tan. If you are getting enough light exposure, whether it's from the sun or from a tanning bed or another source, that your skin is changing from its natural color, you are cooking your skin, whether it's at a low level or a medium level or a high level. And with each exposure, whether it's a slight tan all the way up to a burn, you are increasing your risk for skin cancer, damage to the skin, more rapid aging of the skin. Essentially what's happening is the different wavelengths of ultraviolet light are hitting your skin cells, affecting the DNA, causing mutations, causing changes, which will cause both cosmetic changes that are, show signs of aging, but at least, if not more importantly, the types of changes that can lead you to skin cancer. For people that like to look tan, the different bronzer products that are on the market are considered safe to use to get a tan look. And I do think the products that are available now are significantly better than they were 10, 15 years ago when they were more orangey. And now I think there's a lot more options that are a lot more natural looking. One other topic on this that I do know there's a lot of people when I ask them that it's not so much that they like to look tan, it's that they feel that they get a mood enhancement from seeking out light from a tanning bed or sunbathing, and actually can feel sad or even meet criteria for depression. It's really quite common. This is really a manifestation of seasonal affective disorder, which affects many people, and in a climate like North Dakota, it's particularly prevalent, but there are other safe ways to address that and treat that. There are different types of lights that you can use that are not UV tanning lights to help with mood. And so there's always a way around it. If you're someone who is in the habit of tanning in the sun or a tanning bed, it's not healthy, and there are other ways to achieve the goal that you're looking for without damaging your skin and increasing your cancer risk.
And you're so right, by the way, about the bronzers that are on the market right now. They've come a very long way if you're seeking that little glow. What else would you like people to know about skin cancer and certainly preventing it, maybe identifying it?
Yeah, so a couple of things. One is if you've never been screened for skin cancer, it's really appropriate for anybody at any age to do that. And then, based on the results of a first one, you could be categorized as being high, medium, or low risk. And I'd be able to advise you if it's something you need to do regularly or not that often. One thing that I see that is concerning to me is a lot of people will come in for a specific spot that they notice that they have concern about, which is great. I'm glad that they're coming in. But really, if that's your concern, we always try, both my nurses and medical assistants and myself, when I come into the room, to convince the patient that really the right thing to do with the appointment is a more thorough skin exam. And all that means is you change into the gown and I check you scalp to toe. There's so many areas on the skin that are not noticeable. When a patient comes in for a single lesion, it's almost always on the face or the arms or an easy to spot place. And then it's not rare that if we can get that full skin exam, that there might be something else that needs to be addressed. So I would really recommend for patients to make sure they're getting their skin looked at by a qualified professional. at least once, and then after that, based on the recommendations that come from the appointment. That's really the best way to make sure you've been properly checked. Another question that I get that I think you were referring to is, how do I know if something on my skin is weird and needs to get looked at? Or it's a hard question, really. That's one of the big topics that dermatologists study to be able to differentiate normal things and growths on the skin from abnormal. What I would say as a rule of thumb for the lay person out there is, if you notice something on your skin that is new, changing, really doesn't look like or match up with anything else on your skin, or if it has symptoms like bleeding, pain, or itch, you really shouldn't wait, and you should get it looked at. If it turns out you come in and get it looked at and you can be reassured that it's a completely benign, hey, that's great, and you've got the reassurance. But every day in dermatology clinic, we're finding skin cancers and treating them. So you see anything new, changing, doesn't look like other spots, it's a good idea to get it looked at.
Great reminders for all of us to get in, get checked out. Make sure you come prepared with anything that has changed, just as Dr. Hoffman was saying. Thank you so much for your time today, Dr. Hoffman.
Yes, thanks for having me on. I enjoyed it.
All right, thank you for joining us. And for more information, once again, you can visit SkinWin Dermatology in the Williston or now newly opened Minot office. Make sure to schedule an appointment. Call 701-800-5110 or check out skinwindermatology.com. Yeah, pretty cool. The Minot office just opened up, so go ahead and call to get in.